Hello and welcome to MVMA's Lunch and Learn, Harmful Algal Blooms in Minnesota with Kelly Valine. I'm Nicole Cass, Director of Professional Development at the MVMA and today's moderator. A reminder that the Q&A panel is where you should submit your questions at any point during the session. This can be found under the apps. Look for Slido Q&A panel in your webinar window. I would like to take a few minutes to provide an introduction of today's speaker. Kelly Valine is an experienced epidemiology with the Waterborne Diseases Unit at the Minnesota Department of Health, where she conducts public health surveillance and leads outbreak investigations, including human and animal illness associated with harmful algal blooms. She has a background in science education and received her master's in public health from the University of Minnesota. She joined MDH in 2017, and Kelly has worked for the zoonotic and foodborne diseases units and spent several years during Minnesota's COVID-19 response co-leading an outbreak detection team and serving as a subject matter expert for case investigations and external partners. Please go ahead, Kelly.
Thank you so much, Nicole. Okay, let me get my PowerPoint up here. Okay. Nicole, can you let me know if you can see
It
this?
looks good.
Okay. I will not be able to see any of the chat or questions while this is going on, so please feel free to interrupt me.
Will do. Thank you.
Like Nicole said, my name is Kelly Valine, and I'm an epidemiologist in the Waterborne Diseases Unit. And today I'm going to talk to you about harmful algae blooms. So first, what are harmful algae blooms? What we often call HABs, are blue-green algae that are actually bacteria and called more accurately cyanobacteria. And they can occur everywhere in Minnesota, but really do thrive in our warm, shallow, nutrient-rich lakes. These bacteria can grow quickly when conditions are right and form blooms. These algae blooms that produce cyanotoxins are considered harmful. So they are often described as looking like pea soup or spilled green paint. Blooms are not always large and dense. They can be quite small, and sometimes they just cover a small portion of the lake with little visible algae present. And they also sometimes produce a swampy odor when the cells break down. It is pretty common for the blooms to be pushed around in a water body by wind. So you might see a bloom in one area and then later in the day or later in the week find it in another area. These are all examples of harmful algae blooms and what they can look like. As you can see, some have what would be more classic with the spilled paint, blue-green paint look, and others are just a more diffuse green color. And some have algae mats like the one on the top left corner that are floating around and very scummy. So our prevention message for humans and animals is when in doubt, best keep out. So there's many types of vegetation in lake and most of it is not harmful algae. An example of that is duckweed, which is a non-toxic aquatic plant. We also have chara, which is a form of filamentous algae, often found in lakes with good water quality. You can see that one kind of forms that kind of mass, vegetation mass on the top of the water. And then we also have filamentous green algae, which is a non-toxic form of algae that can create recreational nuisances since it is quite long and can get caught in boat motors. Going back to our blue-green algae, so the problem with them is that they can produce cyanotoxins, and we have three cyanotoxins that are of concern in Minnesota. There are more that could possibly be produced, but these are the common ones. Um, and they each can cause different reactions and different symptoms. So first we have hepatotoxins. That includes microcystins and cylindrospermopsins. We have some neurotoxin, which is anatoxin A is our primary concern for neurotoxins. And then we have a few dermatoxins like lyngbiatoxin A and aplysiotoxin. And each of these can cause symptoms, um, and the severity of illness depends on the amount and the type of toxin that the individual or animal was exposed to. So next I'm going to go through these different types of toxins and kind of the possible signs and symptoms, and also the testing and treatment options that are available. So for the hepatotoxin and nephrotoxins, the route of exposure is typically ingestion. So you really want to be looking for a history of access to any outdoor body of water to 48 hours prior to the onset of symptoms, or a history of access to ingest water or algae material near or on shore. So sometimes we have dogs that are just eating like a dried algae mat, um, or licking it off their fur after they have been swimming. And the time to onset from ingestion is often minutes to days. And really, we kind of think within the 2-day mark. Um, and it has quite a few possible signs and symptoms, including nausea and vomiting, excess drooling, diarrhea, acute jaundice and or hepatitis, blood in urine or dark urine, malaise, lethargy, stumbling, fever, loss of appetite, abdominal tenderness, and photosensitivity in animals. Other differential diagnoses for consideration would be acetaminophen or NSAID overdose, rodent-side ingestion, and aflatoxosis and other hepatotoxic poisonings. Labs that you may consider and other laboratory findings would be elevated bile acids, ALP, AST, and GGT, hyperkalemia, hypoglycemia, prolonged clotting time, proteinuria, presence of toxin in clinical specimens. And for treatment options, I do want to be clear that there's no specific antidotes to any of these toxins that we're discussing today. So we generally recommend removing access to contaminated water, cleaning fur. For these hepatotoxins and nephrotoxins, like microcystin and cylindrospermopsin, you might consider emesis induction and oral activation charcoal slurry. Case reports have suggested that um, I have not said some of these words in a very long time. So cholestyramine may be effective at treating microcystin poisoning, but this treatment is considered experimental. Same with the milk thistle has been used intravenously for general liver protection, and that is also considered experimental. And then any supportive therapy. So for neurotoxins, which is in Minnesota, the main one of concern is anatoxin A. It's also ingested, and the time to symptom onset is usually minutes to hours, with really the onset often being like minutes to within a few hours. The possible signs and symptoms are excessive drooling, apprehension and anxiousness, vomiting, ataxia, muscle twitches, seizures, respiratory failure, and sudden death. Uh, Typically, anatoxin A toxicosis is extremely severe. The differential diagnoses you may consider would be pesticide poisoning, myasthenia gravis, and other toxin poisonings. Again, um, this one for labs, it's really the presence of toxin in the clinical specimens that may be submitted. And for treatment, there's no specific antidote. You really want to just remove access to the contaminated water, make sure that cleaned off any fur, and a supportive therapy. For our dermatoxins, this is typically less serious. Again, you've just they've had exposure to water, and they are now basically having a allergic dermatitis or dermal reaction. So that's typically within minutes to hours with a rash, hives, or allergic reaction. You may consider other allergens, and sometimes you can see a blue-green staining of fur or hair. And really the treatment option is to clean the fur from any remaining algae. So there are some testing resources available, although there really are not many. The main one um, for specimen testing is UC Davis, their laboratory out there. And that would be typically testing and submission coordinated through the vet clinic, although I would be happy to assist in any way possible. And this test may be passed down to the owner. Um, and sometimes we were really unlikely to be in a position right now where we could uh, pay for those testings, but that's always worth a discussion. Um, Specimen type submitted varies by the toxin test, but they often includes contents, urine, or a serum specimen. And then another option, which unfortunately is not available right now due to reduced funding, but I did want to mention because we really do not know when the options will change and it will become online again, is the CDC biospecimen testing program. This is coordinated by an MDH epidemiologist like me, most likely me, and this would be free to the owner, and this is only urine specimens. And I do want to note that there is also the option to for to get examination, a necropsy through the VDL. Um, Sometimes in the past, we have been able to arrange that and cover the costs. Again, we're unsure of our funding available for that at the time right now, but that can be helpful, at least to inform overall uh, what was the cause of death. So if you get a call or a patient comes in and you suspect that it is illness due to a harmful algae bloom, we would like that reported by phone or email. I have the number and email on the screen, and this can be found on our website. Really timely reporting is needed because there are other parts of the investigation, including an environmental component, and we like to be able to complete that part as soon as possible before environmental conditions change. And then there is also a case report form to fill out, and that can be completed and faxed or emailed, or we can even complete it over the phone. I'm very flexible, but really we do like to know about these as soon as possible so we can start our environmental portion. So the illness investigation process is as follows. We get a report of illness or pet death, and then we interview the ill person if it's a human or the animal owner. Or in this case, we would, if you reported it, we would get the information directly from you. Um, and we may then follow up with the owner for additional exposure details. Then we collaborate with the Minnesota Pollution Control Agency or a local jurisdiction to see if water sampling is something that can be done. Sometimes there's somebody in the area, or if the water body is managed by a local county and city that does beach monitoring, we can often have them get some samples. So the site visit happens, assuming that it's within a time period that uh, would we feel that we can collect some water, and it might be a kind of representative of the swim date or the exposure date. And then they take a water sample and do a visual inspection of the site. And then that water is brought to our lab here at MDH. In the public health lab, we do have the ability to do different toxin testings and also identify algae species. And that's done, and typically those test results are reported in 3 to 5 days. Um, the testing does involve multiple freeze and thaw cycles, which is really what makes the testing take um, longer. But if we really needed it, we could maybe get it within 2 days. And then MDH finalizes the reporting to the national database. So a little bit about that national database and HABs illness surveillance in Minnesota. We do have a formal surveillance system with a One Health focus that was initiated in 2014. It is called OHABs. Um, Illness and environmental data are reviewed to determine how likely an illness was related to the HAB exposure, and the case statuses are then determined based on the CDC OHAB's case definitions. So there's 3 case definitions. There's probable, suspect, and confirmed. And basically, as you move up towards confirmed, it requires more and more environmental and clinical evidence that this was due to a harmful algae bloom or cyanobacteria toxin. So a little bit about our cases in Minnesota. So here's a map of the counties and how many cases they've had for animal illness from 2016 to 2025. So in that time period, we've had 12 animal HAB-associated illnesses, 4 suspect and 8 are probable. Um, 10 out of these 12 animals did die as a result of their illness. And I know it doesn't sound like it's very much, but we do often hear about the most severe cases. So it is very likely that there are a lot of mild illnesses that we never hear. The median number of cases annually is 1, with a range of 0 to 3 cases. All of these 12 animal cases are dogs, and exposure to HABs occurred during March through September. So we will investigate any animal case. It just happens that dogs typically want to be in the water and are not very, um, they don't care what the water looks like. They just want to get in it. So, and they're often doing activities that causes them to get water in the mouth, even if they are not directly drinking the water. And then they also lick their fur when they're done. So that's why we mostly see dog cases. And you can see from this map that we do have most cases reported in the metro area. Um, I don't necessarily have a great reason for that other than maybe awareness of reporting of our complaint line. Most of these do come from animal owners directly. We do have a hotline that receives those calls. And then we do have some mostly in the western and southern uh, Minnesota, where often the lakes are more shallow and warmer. So next I have a few case studies. So this first case study is a King Charles Cavalier, 4-year-old male dog who weighed 24 pounds and had no notable past medical history. Uh, this dog had a last date of water exposure of July 29th and was jumping and retrieving balls playing fetch. And the water conditions, they were green in color, but there was no visible algae mats and no paint-like film. And even though the water was green, the water clarity, so like how deep you can see down into the water, was pretty good with you being able to see more than 2 feet. And that was due to zebra mussels in the lake. So, like I said, the dog had been swimming, playing fetch on July 29th, and then had onset later that day. And symptoms include weakness, vomiting, lethargy, their tongue was hanging out, and they were wobbly on their legs. They unfortunately died within 30 minutes after onset. This, the body was submitted for autopsy at the U of M Veterinary Diagnostic Lab. And the differentials the veterinary included were blue-green algae toxicity, occult heart disease, and possible neurologic disease. And the necropsy findings, unfortunately, there wasn't enough urine or stomach contents for further toxicology testing. There was a nonspecific vascular congestion of various tissues, and the cause of sudden death could not be determined. But the water was collected a few days later on August 3rd. I just like to note we do try to collect on the same day if possible that we're notified. And anatoxin A was present between 0 and 2.5 parts per billion. So it may have been at a different concentration on the 3 to 4 days beforehand, but we were still able to detect it in the sample that we collected. And the outcome of the investigation was determined that this dog death was due to anatoxin A toxicosis. Our next case study, and these are all cases that we have had, is a golden retriever mix who is a male who's 10 months old and 66 pounds with no notable past medical history. This happened in early June with the swim date of June 4th. They were jumping and retrieving balls, playing fetch. And on this one, there was clear water color. There was a visible scum on shore, no paint-like film, and the water clarity again was good, but there was one dead bird present. That is actually something we ask on our interview, is if they see any other dead animals in the area. So on that same day, shortly after exiting the water, the dog started vomiting, having a rapid breathing and a seizure, and it died again within 30 minutes after onset. This dog was also submitted for necropsy at the U of M VDL, and really they were highly suspicious and looking for evidence of blue-green algae toxicity. Unfortunately, this body was suboptimal postmortem preservation, so it was really not many findings found, but they were able to collect stomach contents and submit them to UC Davis for toxicology testing, and it was positive for a high level of anatoxin A, over 10 parts per million. The environmental findings, the water was collected on the same day as the exposure, which is very unusual. And anatoxin A was not present and was not tested for. This particular case was many years ago, and our ability to test for toxins has changed in that time. But they did also find a low level of microcystin present. This one was also determined to be death due to antitoxin A toxicosis. So our next case study is a boxer lab mix, about 10 years old, and he was 90 pounds, unknown past medical history. This dog was also swimming in early June. Activities include jumping, swimming, fetching, and drinking water directly from the lake. The water conditions were clear, no paint-like film, but there were some algae mats visible. The onset was June 8th, so it was actually a day after the swim date, and symptoms include jaundice and bloody stool. The dog ended up dying at home on June 10th and did not receive any veterinary care, and the death was not witnessed. So a necropsy was not conducted in this investigation, but we were able to collect water on June 13th. Antitoxin A was not present, but we did detect microcystin in the 5 to 10 micrograms per liter range. And we ended up ruling this as a dog death due to microcystin toxicosis. This next case study actually has two dogs involved. The first one is a lab retriever. She was 3 years old at 53 pounds and had no significant medical history. She was swimming on July 20th, including jumping, swimming, fetching, and drinking water from the river, and was out there for about 2 to 3 hours. There was no paint-like film, no algae mats or scum visible, no unusual odor, but there was low to no water clarity. The dog became ill later that day on July 20th with diarrhea, fever, rapid breathing, lack of energy, drooling, dark urine, seizure, able to ambulate, and paralysis. This dog did receive veterinary care, and testing performed include CBC, cortisol, and repeat serum chemistry panel. You can see on 720 there was low platelets, high ALT, AMY, phos, creatine, potassium, and cortisol was 26.3, and low calcium, glucose, and sodium. Hospitalized from 720 to 723. The treatment provided was dextrose for hypoglycemia, Valium and phenobarbital for seizures, mannitol for cerebral edema, insulin, and dextrose for elevated potassium. Good news is this dog did recover. Then about 10 days later, there was another case at the same location. This was a Labrador Retriever who was 6 years old and he weighed 93 pounds. He had an unknown past medical history. He was out swimming on July 30th, jumping, swimming, fetching, and boating. Again, the river looked very similar, where there was no paint-like film, no algae mats or scum visible, no unusual odor, and low to no water clarity. So later that day, approximately 6 hours after leaving the lake, the dog started having diarrhea, rapid breathing, drooling, seizure, and paralysis. Again, they were able to take their dog to the vet and receive care. And there was a repeat serum chemistry panel, and you can see that it was performed on 731 and then twice on 8/1. And this dog was hospitalized from 7:30 or July 30th to August 2nd. And the treatment provided was dextrose for hypoglycemia, mannitol for cerebral edema, and insulin and dextrose for elevated potassium. This dog also recovered. So there was no specimen testing conducted for either of these dogs. And then the environmental findings, there was not a site visit or sampling conducted due to delay in reporting. If my memory serves me correctly, this was not reported until about a week or longer after the second case. Um, and the outcome is that these dogs' illnesses were likely due to blue-green algae toxicity, but due to lack of specimen testing and also environmental findings, the toxin is unknown. So really, we would like to avoid having our dogs get sick or animals get sick as well as ourselves. So that's why our general message is when in doubt, stay out. Don't let your dog swim. These are all messages to let your patients and their owners know. Don't let your dog swim if there's visible scum, mats, or foam, if the water looks like spilled green or blue paint, and if there's a bad odor. And if they think their dog has been in a harmful algae bloom or water that they just don't feel good about, they really need to rinse him or her off immediately and then watch for symptoms. And if symptoms start, to seek medical care immediately. We do have on our MDH website for harmful algae blooms, we do have a page for veterinarians, and these are all resources that are available on there. We have a few posters. This one in the top left corner used to be a magnet that we're out of currently, but has been popular in the past. And then this is an additional CDC poster on the CDC's website for harmful algae blooms that I think is especially nice for veterinarians. And just a quick mention, our human illness cases and surveillance, because we also do human illnesses mostly at the Department of Health, but dogs and other animals are often indicators for us of potential risks for humans. From 2016 to 2025, we had 13 human Hab associated illnesses. 3 of those were suspect, 10 were probable, and 2 were exposed outside of Minnesota, but were Minnesota residents. The median number of cases annually is 1, with a range of 0 to 3 cases, and the median age of cases was 15, with the range being 2 years to 70 years. And exposure to HABs occurred during May through September. Here are just a few links of resources for veterinarians. And does anybody have any questions?
Yes, we have a couple of questions, and this question you kind of got to or answered during your case studies, where the individual said that they thought that pets generally died before making it to the ER. Is that typically the case? They've never seen algae bloom toxin in person in a dog.
Yes, I would say majority of the time that is the case. I did kind of have to search for ones that that did
Survived.
receive some care.
Yeah. Another question that came in is, do you know, happen to know what the cost would be? You mentioned the UC Davis testing. Any idea how much that
Yes, so
testing costs?
I did peek at it today. So there isn't like the way it's set up is you'd have to select which toxins you wanted to test for. And each of those separate toxin tests, I believe, costs, I want to say like 250 to maybe $300. Um, so definitely, some money.
Yes. Yes. Um, and I had another question and it disappeared. I don't know why. Maybe the person took it back. Do we have any other questions out there? Please feel free to type them in the Q&A area. Everybody's exhausted from the heat, I think.
Oh, yes.
Just gonna give people a few more seconds to type in their question because I know that can take some time. Um, just to thank Kelly very much for providing this information for us today. When I send out the follow-up email with your CE certificate, I will be sure to include some of the links to the resources that she provided for us in this session. I did have another question come in. If the pet is submitted to the U of M for necropsy, do the toxin tests get included?
So no. So the U of M, to my knowledge, does not have the ability to do the toxin testing. They would just be doing their, I guess, standard necropsy. Um, so that would have to be additional, where could possibly collect stomach contents, um, and then send those out for additional testing.
Thank you. Another question came in. How often do blue-green algae is seen in streams or rivers?
That's a great question. So I would say we don't know a lot about that in Minnesota. Our primary, we see most of the cases in lakes, and the same with most, local beach managers are sampling lakes for kind of surveillance. But other states have done a little bit more research on that, and they do find that there are toxins being produced at times in their rivers. So it's definitely not something that I would rule out if kind of the timing and the symptoms make sense. Like I, with that one case study was on the Mississippi River on a beach on there. So, it was in a little slower flow area that can, have a lot of growth in it. So it's definitely possible, but we don't have as much data on that.
Thank you. Another question, is there any concern for long-term issues if a pet recovers, such as liver or kidney damage?
Ooh, I do not know the answer to that. I am not a vet, so I'm not, and our surveillance does not include long-term follow-up, but I'm sure it is possible, especially some of these dogs that do survive, they were incredibly ill.
Thank you. And you mentioned that when we were talking about the different types of blue-green algae that this is mostly for Minnesota. Do you happen to know if that holds true with regards to if it's also common in the Midwest? Does it tend to cluster?
Yes, so the toxins I mentioned are all freshwater toxins. Some of them can be present and I think are present in marine environments, but marine environments also have additional toxins that they are concerned about. So the toxins I mentioned would be very applicable to all of the upper Midwest or any freshwater.
Thank you. As we know, many people have cabins in other states nearby. So,
Yes, I
um,
work closely with Wisconsin, so I feel pretty confident about that.
good. If someone lives on a lake or a pond, is there any way for them to test the water? And if so, would that sample be sent to UC Davis?
Um, so UC Davis, I do believe, does offer just like water sample testing. Um, but really, in general, we don't recommend homeowners just to be testing their water, mainly because blooms can come and go so quickly that by the time you get that back, it's really might not be um, applicable to the current water conditions anymore. Um, the Minnesota Pollution Control Agency does have a jar and stick test that takes about a day and doesn't cost anything other than a jar. um, that you can do, and the instructions are on their website, and I more than welcome to send that link to Nicole. Um, Otherwise, there are labs out there that do independent testing, but it is pretty expensive.
Thank you. I think you sort of answered this question, but kind of in a roundabout way, because it wasn't directly asked. Is there a lower possibility of harmful blooms in running water, such as rivers and creeks, or is it a concern in any body of water?
Yes, it is a concern. It can be a concern in any body of water, but would be less common in a moving body of water like a river and lake, and especially a rapidly moving body of water.
Thank you. Do we have any other questions? I'm just double checking all of the places people could submit questions, and I'm not seeing any. So Kelly, thank you so much for your time and knowledge today. And thank everybody for spending some time with us today. Hopefully that gave you an opportunity to cool off a little bit and maybe get a bite to eat if your clinics are busy today. So everybody, please stay safe and have a great week. Thank you.